So the question that was asked was, what should we do with a cranial nerve 6 palsy? And I'm assuming, for the sake of argument, that we're talking about neurologically isolated acute cranial nerve 6 palsy. And the reason it has to be acute and isolated is if it's not acute, it's chronic, or it's not isolated, for sure you should be imaging that. The acute cranial nerve palsy that's neurologically isolated could be from a number of different things, and of course the one that's going to get better and doesn't need the imaging study is the ischemic vasculopathic 6 nerve palsy. So the patient's older, they have hypertension or diabetes or hyperlipidemia or some risk factor, and that person is just going to get better. And so you could just observe this person who has the neurologically isolated acute ischemic 6 nerve palsy. But because there's all these other things on the list that it could be apoplexy of the pituitary gland and cavernous sinus lesion. It could be brainstem infarct, which is also ischemia, but not small vessel ischemia, but a stroke. And it could be a hemorrhage in the pons. It can be a cavernous sinus lesion, and it could be neoplasm. And in an elderly person, it could be ischemic infarction from giant cell arteritis. So there's so many other things on the list for 6 nerve palsy that really there's no way for you to know which one is the ischemic 6 except by observing that person, and it has to get better. And so you could make an argument that if in a elderly vasculopathic, ischemic, neurologically isolated, acute, painless 6 nerve palsy, you could observe that person, but there's about a 15 to 20% chance you're missing an underlying structural lesion. And so an MRI scan, no one is going to fault you for ordering an MRI scan in every acute 6 nerve palsy. However, if you're going to observe this person, you have to tell them that if they get something else or it doesn't go away, that they're going to have an MRI. You also have to consider myasthenia and giant cell, things that don't show up on imaging studies. So in answer to the question, do you need to image every acute neurologically isolated cranial nerve 6 palsy, even in an ischemic patient? Probably yes. However, you could observe this one case, but if it's not better, you have to image that.